Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you the most practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Jason Ava. He's Director of Information Systems at Kahuku Medical Center. Welcome, Jason.
Hey, thanks, John. Thanks for having me. I appreciate this.
Yeah, this one, I have to admit, this episode is really personal for me. Being back here at Kahuku Medical Center, where my 22-year-old son was born 22 years ago. This is fun, and you and I worked together 22 years ago when you were a student at BYU Hawaii. But anyway, this is really fun to be here to see your progression, my progression since then. But anyway, for those that don't know you, maybe tell us a little bit about yourself and Kahuku Medical Center.
Absolutely. So again, I'm Jason Ava. I'm the director of Information System at Kahuku Medical Center. This July 16th will be my second year here.
Wow.
As you mentioned, we both worked as I was a student at Brigham Young University. So the education industry is a different animal compared to healthcare, which is a different beast altogether. And so this experience has definitely helped me find my purpose in leading a group of leaders in patient care.
That's awesome. You know, at Kahuku Medical Center, tell us a little bit about it.
Kahuku Medical Center is right out here in the North Shore in Ko'olalo. So if you've ever been on island on Oahu, it's very beautiful, very lush out here. We are in the rural healthcare clinic, if you will, serving over 20,000 of our community members. And so we provide services that meet the needs of our community.
Yeah, and I think that's what people don't realize. They think Hawaii and, see Honolulu, big skyscrapers, lots of people. But, up here on the North Shore is very rural. Yes. I mean, yeah, I said my son was born here. Now you don't even deliver babies because there's not enough babies to be able to do it or resources. So it's interesting how that's evolved. But tell us from an IT perspective, what makes kind of managing IT unique at a rural health organization?
Well, that's a great question because if you understand rural healthcare, you know that we are about 45 minutes to an hour from the nearest sister hospitals, if you will. And so having a group like this here in our remote part of town, you get to work with your community on, it's basically your decisions have an instant impact. We wear multiple hats here. Also, I have a team of leaders. There's Shalila Yamashita, and there's Dalvin Kyle, who's our systems administrator. We have Fualima, who is our IT customer support, and we have a couple of interns. There's Quincy, and then there's Emily Freitas. Now, what makes that unique is that they're not just IT. They are in patient care, so they don't work for me. They work for the organization. We all report directly to Steve Nawahine, who's our CEO. In fact, Steve is from here, born and raised. He has brought, if you will, experience to our organization that has taught us on accountability and making sure that we have the resources we need to take care of our aunties and uncles, if you will.
Yeah, no, I think that is the unique aspect. I mean, it's funny you say you're 45 minutes away because my son actually had a complication, got a fever afterwards.
Yes.
We called the Kahuku Medical Center. We said, hey, should we bring him in? They said, we can't help you. Go to town. So I drove that, hour drive into town for him to get care. So that literally is the environment here. And I sped, all the way to town, which was fun, actually. But
Absolutely.
But it is interesting how that's different.
It is a nice drive. I mean, but in cases of emergency, and typically we send a lot of our community members to some of our sister organizations out there because they have our specialty providers who are cardiologists and nephrologists and things that we are plagued with in our community with diabetes and heart disease. So yes, absolutely. And as much as we try, and unique in that aspect is we have them providing those services where it's basically a 5-minute drive from wherever you're living could actually impact that life like instantly.
So talk to me more about that. Like, we talked about the negatives or challenges of rural health, right? But what are some of the advantages of providing care in the rural community to your aunties and uncles, as you said?
When they walk through the door, that's literally your auntie and your uncle, right? Yeah. We tend to do more for our families because we care. That's what makes it unique. Everyone in this building that works here is actually our community. You see them whether they're in Kahuku, Laie, or in Haula, or even further up where there's Sunset and Haleiwa. That's what makes it more of a collaborate effort, if you will, to take care of each other. Because if you look at it, it's the village raising the child. Now the child has grown up, and it's time for the child to take care of the village. So that's the unique part of our services, is that we are literally taking care of our families and friends. The challenge with that too is that we're limited on resources, of course, like everybody knows. We have to wear multiple hats. The urgency is so a lot different. So we're not your typical, we don't run an IT business here. This is healthcare IT, which means from time to time, you might be on the front desk. You might have to run reports. You might even be able to help the emergency department to do some of the if there's a blue code or there's a red code, the triage thing, right? And that's unique, and that is scary. But to get involved, you start to find your purpose here. That, hey, yes, I'm a steward over the IT, which is 1/6 of the division, but yet you get hands-on as allowed to be able to participate in patient care. You may not be the person that is taking care of the patient. That's our provider's job. But on the IT side, making sure our network is available, making sure the equipment works and it's robust to where providers can save lives.
Yeah. Well, I know you guys recently decided to implement Epic here,
Yes.
which, I was always curious, having left here 22 years ago, started blogging about EMR. I was like, I got to see what Kahuku Medical Center does. So it's interesting that you're leveraging Epic here. Talk about that decision to implement Epic at your organization.
Great. So that came from quite a few of our senior leaders. Of course, everything that is approved is from our executive team, but it was based on our community and what their needs were. With OCHIN Epic, because the big sister Epic, that's a pretty heavy lift there. But OCHIN Epic wasn't a light lift either, but it was sized to what we need. Data, information to make informed decisions, care everywhere. My chart, which is one of the efforts that we're pushing out lately, and we've had some success there. And I speak about my chart is because that is probably the platform to help our community to understand where they're at in their life. And then some of the services that we do provide is available, and they can schedule themselves. OCHIN has part of the collaborative, so as we're working with other entities, it helps to educate us as to some things as AI. We have AI as a big thing in healthcare. And so not all of us are privy to understand and be trained on it. So being a part of a collaborative, we get to learn some of those things, and then we can also return that training to our staff here, who will then return that service to our community.
Interesting. You mentioned that you used OCHIN to be able to implement Epic. Obviously, Epic wouldn't contract with you. You're too small on your own. But why did you decide to work with OCHIN? Was it their experience in the rural environments and being able to scale it? Or what set them apart from, you could have gone with another EHR or other options as well.
Well, as I mentioned earlier, just previous to this, we work with OCHIN because they understand rural healthcare a lot better than some of the other organizations that we were working, even working with our last one, which was, if it's okay, I'll say it. Sure. We were with Oracle Cerner. And as times changed, OCHIN Epic adapted to more of what rural healthcare is about. On top of that, their support system has helped us to understand how we could be more efficient by looking at reports, looking at data. We have a fiduciary responsibility not only to the board and to our executive leaders, but to our community and how we utilize those funds. And we don't have a whole lot of money. We don't have deep pockets. Sure. It's basically overall health. So you have to be creative in that aspect on how we're going to utilize these resources to provide the service that our aunties and uncles need. So OCHIN was as a champion. And then one thing that's most important is the buy-in. When Steve Nawahine bought in, then the rest of the executive team bought in. Then it came down to this level with IT is like, now let's push it forward. So our CNO, Andrea Morales, and myself led that project, that implementation, both of them, which is our ambulatory that went live 2024 in December. And then we just went live with acute, which is March 1st of 2026. So it's very exciting, especially for myself. OCHIN is brand new here, and so am I. So for the past 2 years, leaving the education industry, now coming into healthcare, I found my purpose among everyone else who also has a purpose of being here. So that's what made it exciting.
That's amazing. So what has been your experience with Epic so far? I mean, as you said, you started with ambulatory, you moved to acute, and maybe what are some of the successes or even the learnings from your implementation?
One of the things that we've learned is that we all know is that change can be tough for anybody.
Yeah, of course.
Adapting could be tough as well to accepting those changes. We know that what's going on in the world today, healthcare is becoming a challenge even for big institutions, not just the small ones. But so the culture here, that's what's changed, is accountability has been at the forefront with OCHIN Epic. So that means everybody can see what it is that you're doing and what you could do better. And so we can scale our performance, and then you can see the impact that it's having on our community. It allows us to see where the vulnerabilities are and prioritize those things and focus, and then get the right people there to address those things immediately. Those are the lessons that we've learned thus far. And I believe once Steve had reorganized and our organization, he's calling leaders to lead. That's what he's saying. I go, you're in a position to lead. Now I'm going to need you to lead.
I want to talk about the leadership, but before I go there, like Epic's a lot to take on, right? I mean, it takes a lot. Like, what's your experience taking that on from a rural health perspective? Do you see it a good fit for rural health organizations?
I do, absolutely. And the reason why is because prior to going to OCHIN, we were basically doing our best with what we have, what was available to us. We weren't necessarily asking the right questions because we may not know what we were looking for. With OCHIN, being able to provide those resources, the challenge with that is, okay, so what do we do with that information now? Now that we have this, we haven't seen it before. I would like to use an example like MyChart. Why do you think MyChart is so important to our community if our community don't see any value with using MyChart? Well, one of the things with OCHIN is that they've been very supportive on their side. Provide trainings, provide updates as to things that will impact the rural healthcare. And so we've developed a team of ESAs. We have, so the cadence there is we meet once a week to be at the elbows of our directors or our core leaders to help them with their workflows and their processes so that they can make good decisions. We also have had our change advisory board. So if anything that's going to impact us financially would have to be approved among 15 of our members. So therein lies the organization that may have been there, but it's a little bit more cohesive now, because it's not just IT making a decision, it's the CNO, the CFO, the COO, the CEO, all of the C-suite. They have to buy in to ensure that is this what is needed here at Kahuku Medical Center.
Yeah. I mean, we've seen that across all of healthcare. If you don't have buy-in, you're dead, like from the beginning.
I've learned that when I got here, is that if your community doesn't value what Kahuku Medical Center does or can provide, they will take that 45 minutes and go elsewhere. So winning our community is a priority, and how we're going to do that is help educate them on the tools and services that we do have, by not only going back to our old stomping ground, maybe working with, we haven't done this yet, but because we have ties at the Brigham Young University, Hawaii, the Polynesian Cultural Center, we also have the Church of Jesus Christ of Latter-day Saints Temple that's in Laie. We have our high school here, which is Kahuku Red Raiders. We have our team in Haleiwa called the Haleiwa Clinic. And so by pushing these efforts out to these different areas, we now get to utilize our relationships that we've had in these areas to show the services that we have, that they don't have to drive, 27 miles to get that help. So, yeah.
That's awesome. You mentioned leadership, and I know you have a passion for leadership. I see it on LinkedIn. Everyone should follow you and hear your updates. But what are some of the big leadership lessons that you've kind of learned over the years?
Communication and transparency. You don't know what you don't know. And when you're transparent about some of those things, I've understood that, is this an IT concern or is this an organization concern? So for example, OCHIN Epic, was that an IT's decision or was that the organization's decision? So in understanding that, it also leads to accountability. And then it's also using your creativity to help people buy in on what that is. I've learned that rejection just means redirection. So in sitting with some of the top leaders in our state, and they're right here at Kahuku Medical Center, I'm going to name them. There's Steve, he's our CEO. There's Steven Nawahine. There's Andrea Morales. There is Ari Hayola Castillo. There is Corey Napa'a. There's Matt Mamizuka, Dr. Jason Hughes, and Dr. Grace Packard. Every one of these individuals had led this organization superbly. If that's a word, I don't mean to be fobbing out. Right? Some of you guys don't know fobs in Hawaii means like you didn't get the right terminology, but you understand what I mean. With their insights and being in healthcare a lot longer than I have been, their pushback allowed me to think, what is the priority and how do they see IT fitting in that vision? Because guess what? They are probably just as new to IT as I was for 2 years now. So there's a level of trust that needs to happen. This is, hey, figure out what we're doing to advance our technology, bring it back to the team. If our CFO approves that, and then we start working things out. So we have a responsibility financially to make sure that what we have, we're utilizing it the best way we can. And some things that I said, and if it's a loss, then it's a lesson learned, right? So we don't take losses, we take lessons.
Yeah. I mean, it's interesting. I think you're 100% right. That communication and accountability is what builds trust over time.
I agree.
And it takes that, I feel like that's maybe some lessons from the Kahuku Red Raiders football team.
We're only 12 years of state champions, but hey.
It's part of the culture too, that's for sure.
Yes.
We always like to wrap up these CIO episodes with a little career discussion, career advice. What would you say is maybe the best piece of advice that you've received in your career?
Well, there's two. And because I believe a lot of us are on a spiritual journey. So there's one that is to trust in God's timing and have confidence. My grandmother, Sine Liufau Fesango, she shared with me before she died in 1988. I was like 9 years old. She said, there's two commandments I'm going to give you is the truth will set you free. And the golden rule is to treat others the way you want to be treated. I've carried that even here and even now is because as you're discovering your purpose and your truth, that there will be different people in walks of life on every elevation of that. Be kind, be good to them, because you never know when you're going to see John Lynn again after 27 years, right? So those are the things, those are the basic principles and advice that I received as a youngin'. And then even now with the leaders we have today and the staff that we work with, they all have the same philosophy. It's faith and family, and I would say food too, but you know what I mean? Because culturally we want to break bread with each other because, we know stories of Jesus breaking bread, right? So forgive me, I don't know if it's the right platform to be speaking spiritually like that, but when you're working with your community here in healthcare, how can you not think that this is a spiritual purpose of helping people to understand the value that they've contributed to our community? And I think that's the best part of my work here is that I get to sit with my aunties and uncles, and while they're still alive, give them their eulogy of how they raised their child. The village raised me, so it's my responsibility to lock elbows with my brothers and sisters to take care of the village.
Yeah. No, I mean, it happens, I think, Something personal for me. My dad's in hospice right now, and when you're in that moment, to your point, you start questioning what is your spirituality, what is the purpose, and and that happens throughout healthcare. So I love that you're taking your tutu's advice, your grandma's advice, because I think that at the core of healthcare is kindness and compassion and love. So I love to hear that you're doing that, and that brings you the best joys in life, I think. So. Jason, this was so much fun. I'm here enjoying paradise, but to me, this is just as fun as hanging out on the beach. So I appreciate you taking time, and mahalo to you and to everyone at Kahuku Medical Center. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcast applications. Thanks so much, Jason.
Aloha.